This flowchart contains the pharmacokinetic process, which explains what happens next after once a drug are inside the body, how they move around and go where they need to go. But before that, there will be a administration on the top, because obviously there is no pharmacokinetic process if there is no drug administered. Drug administration is defined, or basically the ways how the drug enters into the body. It is whether through the mouth, skin, directly into the bloodstream like IV drugs, or otherwise. The first step for pharmacokinetic process would be absorption. Absorption generally describes the way the drug moves from its site of administration across one or more membranes into the bloodstream if it is not directly administered into it. For example is when a drug is administered orally. The absorption would be through the lining of the stomach or intestine. This process could be slow in the presence of food. Moreover, some drugs can pass through the cells by active transport or passive transport. But one way or another, they will make through on their destination. In describing also this process, absorption, it is important to review the term bioavailability, which is typically described or defined as the proportion of the drug that is successfully absorbed into the systemic circulation. Like for instance are those IV drugs which is administered directly into the vein. The bioavailability of this could be 100% because they are absorbed completely in the systemic circulation or by the systemic circulation. After absorption is distribution. It describes its journey into the bloodstream to target cells in the specific target molecules within, meaning it is the way the drug moves through the bloodstream after being absorbed into it or injected into it. There are factors influencing this, like for instance is the interaction of the drug into the components of the blood, like the plasma protein. If the drug is bind tightly into the protein, it will not be able to reach its target cells. Next, after distribution is metabolism. Metabolism describes the ways that it eventually gets modified by enzymes and rendered ineffective. Metabolism describes any chemical reaction that the drug may participate in, often targeting it for excretion. Like for example is when a drug is taken orally, it will be absorbed through the intestinal wall and then they will be metabolized in it. Finally is excretion. Excretion describes how or the ways the drugs and its remnants finally exit the body, which is through exhalation, sweating, urination, and defecation. In this process, the kidney is heavily involved as they must remove harmful substances from the bloodstream. Some drugs are metabolized into gaseous form and thus easily exhaled, and this is their way of excretion. Some drugs are excreted through bile, so substances secreted by the liver to aid in the digestion, as bile is recirculated back to the liver through enterohepatic recirculation, whereby drugs will be excreted by the kidney and rest will exit in the form of feces. And that we've traced the journey of the drug into the body, around the body, and out of the body, which gives us an understanding about pharmacokinetics.